There are some new guidelines out about vaccine recommendations, including vaccines for COVID, pneumonia, and RSV. Tonight, as part of our monthly AARP-sponsored segment that highlights issues important to older adults in Arizona, we get some clarity about what seniors need to know. Joining us now is Dr. Amit Shah, a geriatrician from Mayo Clinic, Arizona. Welcome. Thanks for being here.
Great to be here.
So let's talk about some of the basics. Obviously, a lot of vaccines to talk about. I want to start with RSV. There's a variety of things going on. Who needs to be getting that?
Yeah, so RSV, new recommendations. It came out last year. Some people got it. It was like discuss with your doctor, shared decision making, et cetera. Now it's very clear. Everyone over age 75 should get an RSV vaccine. There are 3 different ones out there. Any of them will do, but some of the protein-oriented vaccines that are most easily available are probably the ones that I would go with.
So how difficult, I'm obviously very much a layperson, is it easy enough for doctors to identify whether an issue is related to RSV, whether it's COVID, whether it's the flu, whether it's allergies?
Yeah, in the old days, if you had flu-like symptoms, they would do a swab and you might just get a flu swab. Okay. Nowadays, we do multi-swabs where with one swab we can test for multiple things, and we are increasingly testing for RSV, recognizing that there's actually quite a bit of RSV illness. And RSV is not just a common cold. It can actually put people, especially older people, in the hospital with almost at the same level of influenza. It's just that we now finally have a vaccine for it. It's also very dangerous to infants who end up hospitalized at high levels. So if grandpa gets it, the grandchild could really suffer. So.
And every year as flu season approaches, the determination is made whether we should all get vaccinated or not. I'm sure you'd recommend we would, but
yep.
How efficacious is it this year? Do we know yet?
Yeah, so the flu vaccine's a little bit simplified this year. The old one last year had 4 strains. We've seen one that just isn't circulating, so they simplified it. It's a 3-strain. Older individuals should always request the high-dose flu vaccine. Okay. The immune system doesn't respond as easily to vaccines, and so we use a little bit of a higher dose of the vaccine to make sure people get a good response. And so the one for people over age 65 is a single vaccine, one time, and you can get it at the same time as your other vaccines. It's safe to do so.
Okay.
But flu is still the #1 most important vaccine to get, causes a significant amount of illness and death, so very important.
And pneumonia?
So pneumonia vaccine, there's a new one that was approved in June. Okay. It's not available quite yet. I think it's being shipped pretty soon here. You'll see it. It's called the PCV21 vaccine. The old one was either the 15 or the 20 vaccine, and so you're like, oh, what's the difference? It's 20 to 21. It's just one, but actually this new one has 11 different strains. It's been modified, and it reduces really bad pneumonia, the kind that puts you in an ICU kind of pneumonia, invasive pneumonia, about 26% better coverage than the old one. So very important if you've never gotten it and you're over age 65 to get the pneumonia vaccine. If you have gotten it and it's been over 5 years, discuss it with your doctor. And if you're any adult with any high-risk conditions, the pneumonia vaccine is recommended. And now it's just one shot, and it's very simple.
Guidance for COVID, and I ask that because and obviously there were many people cynical about it, but yep. There was also a high percentage of people who got it. I was boosted a couple of times.
Yep.
Everyone I know did that as well. But now it seems like the percentage of people getting the vaccine is down.
Yeah.
With herd immunity and other factors, is that okay or is it not okay?
It's really not okay. COVID is still causing significant amounts of illness. We've gotten away from the booster language. Okay. We're calling it a revised vaccine. Just like we do for flu vaccine, we adjust it every year. Same thing with COVID vaccine. We're trying to stay ahead of it. But COVID still is causing a lot of hospitalizations, especially in older individuals. And unfortunately, the uptake of the COVID vaccines is really, really abysmal. And we need to do better because it's still vaccine preventable. Probably 50 to 60% reduction in hospitalizations and deaths. So really important to continue to get that COVID vaccine. It's gonna, it peaks a couple of times a year, so yeah. We're hoping it won't have to be a twice-a-year kind of a vaccine, but it probably is going to end up being that, depending on how quickly it mutates. And the new vaccine that is just hitting this week, you can go and get it this week, is really wonderful, and in terms of matching the current circulating strains a little bit better.
We're down to about a minute left.
Yeah.
When it comes to COVID, how much did the COVID vaccinations and misinformation and doubt, how much has that caused complications in your world? How much has that caused complications to get more people vaccinated?
Yeah, it's a hard thing. Usually it was okay. Yeah, it's time for my vaccine, and some people are like, I never get vaccines, et cetera. But more, you didn't have to sell vaccines as much to your patients, and I found that I really have to explain a little bit more how they work. Patients are skeptical of certain vaccine technologies without understanding it. So for the RSV vaccine, one's an mRNA one, and some people are like, I won't take the mRNA one.
And does that depend on age, or if someone's older?
All ages.
Okay.
Yeah, and I think just understanding that. These are not experimental. Some of this technology has been around for a very long time. Yes, they were developed fairly quickly, but we see evidence of benefit. And I think what people fear the boogeyman, the monster in the closet. But really, what people aren't seeing is long COVID, and they're not seeing patients who are dying or being very, very ill and hospitalized. Yeah. And that's still happening. And I hope that people would follow the recommendations, and talk with their doctors if they have questions.
Great message, Dr. Shah. Thanks very much.
Thanks for having me.